Alrighty, I'm going to go ahead and get started. I have 6 o'clock on my phone, and I want to be respectful of folks' time. Thank you, everyone, for joining us tonight. I know we have a relatively small group, but I think it's important that we do one of these presentations during the day and one of them in the evening to accommodate folks' schedule. My name is Brian Dowd. I am the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health. And I have been the business owner for EVV for about 3 years now. We start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to talk about today? We're going to give you an EVV member update. We're going to give you a project update. We're going to talk about the EVV training resources. We're going to talk about common issues or questions. We're going to go over next month's DCH EVV Town Hall. We're going to talk about third-party EVV vendor updates. And then we're going to do a Q&A at the end as time permits. So let's start with EVV member updates. One of the things that we have learned, we've since the beginning tried to make everything completely open and publicly available via our website, our frequently asked questions, banner messages, Twitter accounts, YouTube. I know I've spoken in numerous Facebook groups as well. So we've tried to put everything out, make it openly public to everyone and completely transparent. But one of the lessons we've learned is that, particularly for the self-directed community, it's a good idea at the beginning of presentations to just do a little brief highlight for folks who are participant-directed or self-directed, so they know whether or not they need to continue with the presentation or if this is targeted to them or not. We did have some town halls that were completely about self-direction and nothing else. So nothing has really changed. So in the last month associated with self-direction, you need to be working with your individual chosen fiscal intermediary. And that fiscal intermediary varies by individual. Some folks have Acumen, some folks have Continuum, and some folks have public partnership. Each of them are implementing EVV in a different way. We will provide you with contact information. And you're welcome to stay for this presentation because we'll go over some frequently asked questions, but most of the information is really specific to traditional providers in tonight's presentation. So here are the self-directed contact information by plan, Acumen, Continuum, and public partnership. Acumen is moving everyone to their DCI system as of 7/1. So pretty much everybody right now is working on their EVV, which will integrate to the NetSmart EVV system. As far as Continuum goes, they are using the TELUS system. They have gotten the employees loaded, and we're working with them to make sure that members can see the information and not lose any functionality as far as units used and budgeting. Public partnership, we're still working with getting them on board. They have their system that works, Time for Care, and there's a presentation out there that you can log into to look at their presentation. But we're still in the process of getting them fully contracted and updated. We're confident we can do so, but we are really focused on getting them on board. Okay, we'll go forward to another very important topic that could impact self-directed individuals too, and that's Georgia Lifeline. Initially, we told members and providers that we would be utilizing in the EVV system a fixed device or key fob. As we implemented Georgia's EVV, we realized that the key fob technology or fixed device technology was antiquated, and it was no longer an industry best practice. So we removed that as an option. The preferred method for doing EVV is an application on a smartphone. If a worker does not have a smartphone, they may go to our DCH website, which we will point out to you later, and apply to use IVR or telephonic use for EVV. If they don't want to do that, another option that we have available is members can get a free smartphone. Through this link right here, any member can get any Medicaid member is entitled to a completely free smartphone. And that smartphone includes unlimited text and unlimited talk. And the other good thing that we have learned through Georgia Lifeline is that any data associated with EVV does not count towards the monthly free allotted time for data. So even if a member gets a free smartphone and uses all of their free data minutes doing things other than EVV, doctor's appointments or whatever they may do with their free minutes, EVV will still work because Georgia Lifeline has made data associated with EVV, the telesystem or third-party systems, not count towards the data that is free on the phone. Now, there are other federally sponsored smartphone options that are out there, but we haven't been working with those smartphone options like we have Georgia Lifeline. So we can't say whether those phones will be compatible with EVV. We do know that the Georgia Lifeline phones are compatible with EVV. Some of the other programs use repurposed or refurbished phones, and Georgia Lifeline doesn't use refurbished or repurposed phones. They're new phones that are more than capable with their operating systems to download the Mobile Caregiver app. Okay, let's go to EVV project updates. So where are we? We are past the July 23rd, 2021 mandatory timeline for providers to have registered with EVV. This week, we got our list of those providers that are PSS or CLS providers and have not registered. We will, in very short order, probably early next week, be putting those providers on prepayment review. If you are on the call, I encourage you to make sure that all of your provider ID numbers are registered through TELUS. Some folks have 5 and 6 different offices that provide PSS or CLS. So they may have a 12345A number and a 12345B number. And one is for Savannah and one is for Stone Mountain. Well, you got to register both of those numbers. You can't just register one of your numbers because we actually do that registration and prepayment by review by individual IDs. Now, if you have an ID for something other than PSS or CLS, let's say you do group, community access group, or you do adult day health, those do not have to be registered because only CLS and PSS are required EVV services. As of August 31st, 2021, each provider ID needs to have one claim successfully submitted to TELUS. So a worker will have to schedule a visit, go through the visit, and submit a claim by August 31st, the end of this month, or we will put that ID in prepayment review. As of October 31st, a full month later, all EVV claims must go through the EVV system. If you're using a third-party system, they must integrate with the state system. But all claims will be required to go through EVV. GAMUS will no longer work for your billing for CLS and PSS as of October 1st, 2021. So, what if you have not registered? You need to go and register now. And then shoot an email to evv.medicaid@dchga.gov. Give us your ID, your Medicaid provider ID that you registered, so we can make sure that you are no longer on prepayment review or you never go on prepayment review. If you have registered, continue to follow the steps on the toolkit or checklist that we have on the website, which includes completing applicable training, ensuring your aides have downloaded the mobile app, completing some visits, and submitting claims. Remember that deadline of August 31st, 2021, where you must submit at least one claim by each provider ID. The next big question I've been getting from several folks out there is, well, what about case management functionality? You all said case management functionality would be available, and it will. On September 16th, 2021, the case management functionality will become live for EVV. Right now, there is nothing for case managers to do. You could attempt to register at this point, but you're not going to be able to see anything. So I'm just going to ask, if you are a case manager online, to just hold off until we send a banner message and email communication saying that registration would be the best point for you to start registering your case management agencies for functionality. We will have guides and checklists that will walk case management companies through the process, just like we do for traditional providers. All right, let's talk a little bit about EVV training. If you are a provider using the TELUS system, you don't have your own third party, you're using the TELUS system. Each ID should be registered, as we've discussed, and administrators, that super user, the one who can do everything, needs to make sure they have done 3 trainings: the administrative console, the mobile application, and the claims console. Those 3 trainings, you must do those 3 trainings. Caregivers or aides don't need to do all those trainings. The only thing they need to become familiar with is the mobile application. So they need to really focus on that number 2, the mobile application, and become very, very familiar with the mobile application. Providers using a third-party system, administrators still need to register for their IDs, even if you're using a Therap or a Sandata or an outside system. You still got to register your provider IDs, and you still need to go through the administrative claims console training, because you're going to have to still do claims functionality through the NetSmart system. Your caregivers or aides do not need to complete the NetSmart TELUS training, because they're going to be using your third party's mobile application. So the NetSmart EVV mobile application really doesn't matter to them. They just need to make sure that they're familiar with whatever your third party mobile application training is. If you go to this website, and again, this website is available on our DCH EVV website, and it's all of the trainings are posted on there, so you can go in and get this from last month's training or this month's training, which will also be available. And if you go to the website, you will see those trainings I just talked about: administrative console, claims console, and mobile application, right? And there's also extra topics. There are weekly live webinar trainings, and there are also pre-recorded webinars that you can watch at your convenience, just like you can go back and watch these town halls at your convenience. If you have a question after looking at all the training materials that you have that, hey, this is not answering the question I need, on that same website, the TELUS.com training website, there is a weekly live Q&A session with NetSmart experts. So if you go to that extra topic tab, which I showed you right here on the right, this red tab, if you go to that, it breaks down to this, right? You see here, you got Nebraska and Kentucky, and there's also a Georgia, right? And for Georgia, you can register for this weekly EVV Q&A. You will have a NetSmart expert who will walk you through whatever your questions are. I have been told that there is very, very low participation in these trainings from our providers. So there's really no excuse for you not utilizing this Q&A to get your questions answered. Once you have registered as an administrator, you will have on your administrative portal a little tab on the left underneath the dashboard that has trainings. Here, you can locate user guides and short videos. There are tons and tons of short videos that go from 6 and 7 minutes to 12 and 13 minutes on every single aspect of utilizing the system. Everything from resetting your password to how to do claim submission. There's user guides as well that you could print out and make available to anybody within your organization. Those are yet another training resource that is available for you all. Okay, let's talk about some common issues and questions. I get a lot of questions about documentation. nothing has changed about our documentation standard. So if there is something that is captured by EVV, you don't have to repeat it. Like you clock in and you clock out. So that's your time in and time out for CLS and PSS services. So you don't need to document that on paper. Tasks are your documentation of activities that you have performed, whether it be cooking, cleaning, bathing, dressing, whatever. That is the task that you would normally document for your time. So you don't need to redocument that as well. But we've been asked, well, what about RN signature? Do we no longer have to do RN signature? No, the documentation standards have not changed. So if it's not captured on EVV, you will need to print out the documentation and do your signature manually or however else you want to document it in your case notes. Even if that is RN is reviewed, the tasks that are on the timesheet or the weekly schedule and have validated that they are appropriate. So that when an auditor comes out, they can see everything that's in EVV. So you don't have to explain stuff that's in EVV because the auditors can see that. But if it's not in EVV, they're going to want to know where it's on paper. Another question that I get a lot is, what about retroactive billing? Sometimes I have a member and they're not Medicaid eligible for a month. And what am I going to do? Well, there's a way to administratively go back and add in those missing periods. We get a new member when there is an active prior authorization for service. So if they have a pending application with the Division of Family and Children Services, that application has to be approved for Medicaid, and then the case management agency or the entity that authorizes the PA, the prior authorization for service, must put in that PA. If they do, then that member's information and the PA information passes over to EVV. If that takes a month, you can go back on the administrative portal and enter in the time from where the person became eligible for EVV. I mean, for PSS or CLS and needed to be shown in EVV. What about missing members or authorizations? Again, a lot of times we get questions about missing members and authorizations, and the members and authorizations are out there. They're just under a different ID than you think they are. You're looking in that Savannah ID and they're on the Stone Mountain ID. But if you can't find them in any of your IDs and you've done your due diligence and you've looked, call the call center. The call center will try and help you find those members or those authorizations. I'm getting very few questions and concerns about authorizations, but I still get some questions about missing members. So call the call center. The call center will help you find it. If they can't find the member, they will open a ticket to make sure there's nothing wrong in the system. What about registration for providers using a third party? We've already talked about that. That is still required. And we have provider checklists for third-party providers that are available within this presentation and on our website that you can utilize to make sure you're covering all your bases. Again, this is the call center information. So 1-833-701-0012 is the phone number, 833-701-0012. There is also an email that is available and a website for chat. And that information is all available on our DCH website. So what are we going to be talking about in upcoming town halls? We're going to be talking about the same thing we talked about this month. We're going to talk about what you all need to know. So we're going to look at our mailboxes, we're going to look at our call center information, and we're going to address what we think is most important to you all. We plan on doing an extra town hall next month as well. We're going to do the normal 2 that we do at the beginning of the month, but we're going to do another one right before we go live with the mandatory claims edit in September to ensure that any last minute questions, any procrastinators out there that are panicking and have questions, have an opportunity to get in touch with us via the town hall. I'd like to also do what we always do, which is give you an update of where we are with our third-party vendors. As you can see, there are a lot more people that are moving to the right here. So we have quite a few number of people in production, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, that are already fully implemented in production. We have easily that many that are in pilot, which means they're passing information back and forth, and they're almost complete in their EVV integration process. We have a few more that have begun the testing process, but they're not fully in pilot, passing back and forth all of the information, which they are doing in pilot. We have others, quite a few more, that are in development, which means that they're just now getting connected and they're starting the process of passing over information. And then we have 1, 2, 3 that we are still working through contracting with, and 2 more that have approached us and we've given the information about contracting. I'd also like to let you know there are 1, 2, 3, 4, 5, 6 third-party EVV systems that have declined integration. If you are using any of these 6 declined integration EVV vendors, Amira, First Visit, King David, Nemicare, Point Click Care, or Residex, we're assuming that's because you're either using another third party or you're going ahead and using the TELUS system. But if this is your plan to use one of these declined third parties and they're not integrated with us, remember October 1st, you will not be able to use GAMUS. So you need to have an alternate plan for claim submissions for CLS and PSS services. All right, we are at the question and answer portion of tonight's presentation. It's a little quicker because we are just solely sticking with frequently asked questions and things we think you need to know. This again is the call center number and the EVV mailbox for the call center. If you have questions about missing members or any other very specific questions associated with EVV, you are welcome to use that. Okay, I'm going to try and look at the questions and answers now and see what there is in the Q&A mailbox. Oh, wait, I didn't mean to do that, y'all. I am very sorry. Let me stay at this right here. I don't see anything in the Q&A mailbox. Am I missing something? Let me try the chat and see what's in the chat. Oh, there's some stuff in the chat, so that's why. The URL for the EVV website, it is contained right here. So it's in the chat. You can get it from the chat, or you can go to Google and put in DCH EVV, and it'll be the first thing that comes up. The next question is there any difference between caregivers' input into the chosen EVV solution and employees' input into the chosen EVV solution? No, when we say caregivers, we are talking about employees for this context of EVV. They are your aides. They are your employees who you are using as caregivers. So there is no difference. Okay, let me check one more time. Seeing no additional questions or chat, I'm going to pause for just a second and thank everyone for their time here on a Thursday night. I appreciate you continuing to work with us and move forward with EVV integration. Thank you, and I hope you have a great rest of your night.